Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. How much do you really know about your spine? Well, an adult human spine consists of 26 movable segments, 7 in the neck, cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. There's also 1 sacrum and 1 coccyx, which is your tailbone. Intervertebral discs separate the segments from the second cervical vertebra all the way down to the sacrum, and a thinner disc is present between the sacrum and the coccyx. Intervertebral discs comprise about 25% of the height of the adult spine, and the intervertebral joints connect vertebrae in these joints, and they're also lined by lubricating synovial membranes. All these structures are designed to last a lifetime, pretty much your whole life. Intervertebral discs are a gel-like colloid, and they begin to lose their water content at about age 2. This slow resorption is perfectly normal, but nothing really lasts forever, and all living structures degrade eventually over time. So with this in mind, you can understand how it is that x-rays of older people show various degrees of degeneration or arthritis of the spinal joints and the intervertebral discs. So these physiological changes are ominously or portentously referred to as degenerative disc disease by certain specialists. But it's important to remember that these structures deteriorate naturally, and degeneration or breakdown of the spinal joints and the discs is not a disease, but rather a standard process that occurs over time, more rapidly in some than others. There are measures you can employ to resist the effects of spinal degeneration and possibly even slow the process itself. Spinal degenerative changes are problematic because they result in loss of resilience, flexibility, and mobility of your spine. So the overall result is degradation of spinal function, increased possibility of strains, sprains, and many other types of injuries. So there are many different types of solutions, and research studies have consistently demonstrated that regular vigorous exercise and healthy nutrition provide significant benefits in maintaining spinal structure and function. Regular exercise like walking, running, bike riding, strength training provide consistent weight-bearing stress to spinal joints and the discs, and such mechanical stresses are required for these structures to function properly and maintain their physiological integrity. So, for example, exercise pumps fluid back into the intervertebral discs and increases lubrication of the spinal joints. Healthy eating provides the nutrients required to support efficient repair and replacement of the cells and tissues in the spinal components. And by choosing to implement these healthy lifestyles, you can help your spines in help them stay in peak physical condition and become better able to withstand negative effects of stress and physiological forces occurring over your lifetime. Also, having a healthy spine depends on getting regular chiropractic, exercise, good nutrition, and rest. The primary requirements for spinal health, but there are limitations and restrictions in the form of spinal joint movement and dysfunction and nerve interference, and these limitations prevent your spine from working properly and can lead to stiffness, loss of mobility, ongoing pain, and even injury. That's where chiropractic care comes in. So check us out at newhopechiropractic.com and set up an appointment to come in for a complimentary consultation. We can find out if chiropractic is right for you. And with that, I hope you have a healthy day.